Hello, I'm Dr. Tom Drake, and today I would like to talk with you about sleep hygiene. Now, most of you think all you have to do is brush your teeth, wash your face, and hit the pillow, but there's actually quite a technology behind the proper sleep hygiene to help you get the best night's sleep. And the first thing that I'd like to talk about is diet. Lots of us like to drink coffee and pop, and those contain caffeine, and caffeine is a stimulant. So if you're drinking coffee or pop after 8 o'clock, that's going to have a tendency to keep you awake and make it more difficult for you to sleep a restful, deep sleep. Another thing that people like to drink is alcohol. Alcohol is fine in small moderation, but if you drink like 1 or 2 glasses of wine or a couple of mixed drinks close to bedtime, you might think that that's going to help you to sleep better, but in reality, it acts as a muscle relaxant and actually collapses your airway more. So too much alcohol is definitely bad for people that have obstructive sleep apnea because their airways are narrow to begin with. Another favorite thing in the diet is sugar. And sugar actually is a stimulant that makes your blood sugar go up and then crash in the middle of the night. And that will often wake you up if you've had too much sugar and your blood sugar is going up and down a lot. The final thing on diet would be, and again, this is maybe obvious to many, but don't drink too much fluids after 7 o'clock, because the more fluid you drink, the more urine you're going to produce during the night, and the more you're going to have to get up and go to the bathroom. So if you can limit your amount of fluids after 7 o'clock, then you have a better chance of sleeping all night through without having to make a bathroom stop. The second point of sleep hygiene is exercise. And I can't tell you, from personal experience, I can tell you that when I exercise, I sleep better. When I don't exercise, my sleep is much more fragmented. So even if you're just doing a brisk walk after dinner, some kind of exercise, not right immediately before bedtime, but sometime during the day, will actually help your body to reach a deeper, more continuous sleep cycle. The third point of sleep hygiene is sleep at the same time. So go to bed at the same time if you can, even on the weekends, because the body likes schedules. Have you ever noticed how if you're normally eating at noon every day for lunch, how your stomach starts growling if you don't feed it at noon? Well, that's because your body likes schedules, and it likes a sleep schedule too. So if you're going to bed at 9 o'clock one night and then staying up until 11 another, and then going to bed at 10 another, the body's confused, and it's going to make it harder for your body to get into the routine of slipping into a deep and restful sleep if you keep changing the time of your bedtime. The fourth point of sleep hygiene is sleep in a cool, dark room. 65 degrees has actually been shown to be an ideal temperature for helping the body lower its own body temperature and slip into a deep sleep. If you're too hot, it's pretty hard to sleep. And if there's light in the room, then your eyes can even sense and detect light even when your eyelids are closed. So it's important that you don't have any night lights on if you can help it, and things like that. And then the final point of sleep hygiene is limit your blue light exposure. And blue light comes from, guess what? TVs, computers, and phones. So all of you that love to watch TV in bed or mess with your phone for 15 minutes before you go to bed, that is actually stimulating your pineal gland, and that is going to make it more difficult for you to go to sleep. So if you have to do those things, then try to wear blue light blocking glasses, and that will help that problem. Another thing is try and read a book or something like that before bed rather than watching TV. And the more boring the book, the better. So those are my 5 tips on diet, exercise, sleeping at the same time every night, and a cool dark room, and limit the blue light. So I hope that's been helpful to you. This is Dr. Tom, and this is another episode of Sleep Talk with Dr. Tom.